show for our chief residents. It's important to them. And I am not going to take up any of their time. I'm going to have them give a little introduction about where they grew up and a sentence or two about them. And then they're going to go into tell us what they learned in their last 7 years. Thank you, Gil, for starting off. Gil, tell us about you.
All right. Guilherme Barros. I'm graduating R7, going to Mount Sinai next year for an ambassador fellowship, and happy to be here. Thank you, everyone. So the title of my talk is Lesson Learned, my friend. To all the other trainees, if you've heard this quote already, you know what I'm getting at. It's a tribute to someone I've learned significantly from, especially in the last year. If you haven't heard it yet, well, you've got some lessons to learn. I'm excited for you. This is a photo from Volunteer Park through the Black Sun sculpture. Disclosures, I'm not a master at any of these lessons. I'm still working on them every day, and I'm constantly reminded of that. One of my favorite views of the city from Belltown looking south at the stadiums, the ferry docking, and of course, the majestic Mount Rainier. These are in no particular order. But first, let's bring it back to 2013. Just before starting med school, I came to visit my cousin, Paulo, who was doing an internship with Microsoft here. It's my first time in Seattle. He showed me around Gasworks Park and all the normal touristy things you do. At that point, I was only 23 years old, but I already knew I was going to do neurosurgery. I was planning to stay in the Northeast. I did a quick search on my phone at the time, and I saw, oh, they do have a neurosurgery program here, and it happens to be a good one. Maybe I should think about this place. So I started looking into it a little further, and that was the first time I even considered Seattle as a place to do residency in and live. And I credit that guy to kickstarting my interest in the program. I ended up doing a sub-I here in 2016 after a Pittsburgh one, and that was a huge relief. Really set in that I wanted to do my training here after meeting all the residents and faculty. Sam Emerson was a R3 at Children's. I'll never forget that week with him. Lynn was on vacation, and he was in a particularly good mood. Those are some good times. This is me at Cary Park during my sub-I when I was 26. So number one, you will grow whether you want to or not, professionally, physically, personally, emotionally, spiritually. Each of these arenas will be challenged over and over again. You'll grow because of it. Growth comes from challenging situations and uncomfortable situations. And there's plenty of those in residency. This is the three of us just before starting residency. This was at the Palisades overlooking LAFA in June 2017. That was at Sean McAvoy, Peter Chiarelli, Rob Oxford, and John Nerva's graduation. A few days later, we got our long white coats. I went from medical student to wearing the long white coat as a neurosurgery intern, and I thought I was so cool, had to take a bathroom selfie. Little did I know I would rarely ever wear this thing, but here we are. Number two, every new role has a steep learning curve. Intern year, a new year, a new rotation, a new hospital, a new role in the same hospital. Keep that in mind when you're working with others and for yourself when you take on a new role. It may seem overwhelming, and you may ask yourself, how can I possibly learn all these things in the next month, in the next 4 months, in the next year in residency, in my career? But give yourself time, believe in yourself. Brain surgery and spine surgery are not easy. Don't let anyone tell you that. It takes daily dedication. That's why it's 7 years. If you made it this far and you want to be a neurosurgeon for the right reasons, then you will get there. But you need to truly believe in yourself, your background, your skills, and that will get you to where you want to be in this career. And if you don't believe in yourself, others definitely won't. Don't let the doubters and the haters get to you. Just like in F1, head down, mode push, you will accomplish what you want. But you got to put in the time and the work. I find this pic pretty funny. This was the resident roster when we were interns. This was hanging up in the OR front desk. An R2 and an R3 that happened to be circled there were especially not allowed to book crashes. Those were very good learning moments for myself. Number three, you learn from every single attending, no matter if you're going into their specialty or not. This applies for also your fellows, your chief residents, your senior residents, your R2 when you're an intern. And even if you don't get along with them personally, you will learn from them. They have valuable things to teach you, and invariably you gain a lot. The good, the bad, the ugly, you grow personally and professionally from it. You become a hybrid of all these things. Take the good, leave the bad, and you'll use that knowledge in the future. This is a picture of Dr. Zhang doing our last spine call case. This was a couple weeks ago. Even though I'm not going into spine surgery primarily, he's one of the people I've learned from the most in the operating room, in the clinic, how to run a busy practice, OR behavior, professional character, interpersonal relationships, everything. So I really I'm lucky to have trained with him, and the list goes on. Keep your resident friends close. I think this is really important, especially in your class. It's hard. We're all busy. We're all stressed. We're all tired, but it's key to making it through gracefully. The work's tough, but do your best to keep these lifelong professional relationships alive. We're all in this crazy boat together, and you can't do it alone. So, go ahead, invite that junior resident or your co-resident out for a drink or get some dinner. Top left, that's us at our local watering hole called Local in South Lake Union. Top right was us at the Chief Roast 2 weeks ago. Middle left is Kelly Collins and Brian Hannick's graduation in 2018. The middle right, one of my favorite pictures of residency. This was an epic boat adventure that we did a couple years back. Bottom left is John, Chris, and Abdullah's Chief Roast that I hosted alongside Bass 2 years ago. And the bottom right is Bass, Rajeev, and I, and Whistler last year. Perception is reality. I've heard this a lot. It's probably the most important lesson. This is me as an intern, still surprised at myself that I was a doctor and doing neurological surgery at UW. If you have the badge and the uniform, you have to play the part. It's not for show. But the truth is, what other people think of you is actually more important than what you're doing. You can be the hardest worker in the room, but if you have some bad interactions with some key people, that can all go disregarded, and it takes you a long time to dig yourself out of that hole. So never forget that. Everyone's fighting their own battles, both internally and externally in their personal life and their professional life. Remember that. And everybody does have their own strengths and weaknesses, even though it might not seem that way initially. But this applies to everybody, your co-residents, your attendings, your fellows, neurology, anesthesia, PICU, the Gen Surge team. Try to be kind. It's free. It's hard when we're stressed. We're probably obviously some of the more stressed people in the hospital, but it's really key to be self-aware in your interactions with other people. For your own daily battles, this is when you have a partner, your family. You can't go through this without support from other people. It does take a village to make it through these 7 years, and I owe most of these people up here. An individual hobby is a must, or two. If you don't have one yet, you have no excuse. Seattle's a paradise for anything and everything recreational. You really need to get out there. It's important for your mental health and sustainability. It's an outlet over 7 years, and it'll keep yourself from going insane or insano in some cases. This is Whistler and somewhere in Seattle biking. I don't remember where. I just want to take some time to highlight some key faculty that I've worked with over the 7 years that really were instrumental in my development as a neurosurgeon. Like I said before, I learned from every single faculty, but I think these up on the screen here were special to me. Dr. Ellen Bogan, of course, Dr. Shaker, Dr. Kim, Dr. Levitt, my cerebrovascular mentors. Dr. Chestnut hasn't been the same without you here at Harborview. I just want to pay special tribute to him. He's someone who was here at 6 a.m. every day from day one to now. So, without him, it hasn't been the same. Dr. Zhang, Dr. Hofstetter, and Dr. Lee. I admire each of you, and I'll be a hybrid of each of your styles and values. So I'm really thankful to have worked with each of you. My former chief residents, Jake Ruzovic, Sam Emerson, Rob Buckley, Rob Bono, some of which those are faculty here. And then Chiba, Bales, and Kelly Collins. You all were incredible teachers to me, especially as junior resident, and I was lucky to work with each of you. My co-residents, this is a fun time we had this past weekend. We got dinner together, just the four of us, something that we definitely didn't do enough of, but it's nice to be together even for a brief moment. My family, my sister, Alicia, my brother-in-law, Chris, my mom, my dad. This is us in Kapiti last year for my dad's birthday. And Kate, this is us this past February on the Big Island, Hawaii. It's been a wonderful and unexpected experience having a life partner who deeply understands your venting when you come home after a long day. Just a closing slide here. This is one of my other favorite views from Belltown, looking over Elliott Bay and the Olympics in the background at sunset. As one sun sets, another one rises. As one chapter closes, another begins. Here's the next chapter. Thank you, everybody.
Beautiful. Next, Dr. Greil. Good job.
Not all of us got to be on elective for the last 4 months of residency. So I was told to give my chief resident talk, and that is what the title is. So I'm looking forward to, hopefully graduating in a month. So far, things seem okay. I think Dr. Frere is going to let me go. Dr. Ellen Bogan's given me the thumbs up. I'll be doing a spine fellowship in the University of Utah next year. So just a couple things that I've learned over the years, things that I wish I had done better about as being a junior, things that I'm sure that my chief residents told me to do, and I ignored them because I thought that I was great. And just a reminder, we tell you these things all the time. In 7 years, you'll realize that you should have done it sooner. So ask questions. Every day is an opportunity for you to learn. So do that. You can learn from your senior residents, your chiefs, your fellows, your attendings, but also make sure that you learn from your patients, the nurses, the OR staff, and your juniors. When you go in and do a case as an intern and no one else is there with you, everyone else in the room knows what they're doing more than you do. So just remember that even if they're not a surgeon, they have a lot to teach you. And if you don't ask, you'll never know the answer. So when you're in the middle of a case and your attending asks you if you have any questions, when your chief asks you if you have questions after you present a consult, you probably do have questions. If you don't ask them, you'll probably regret it later. Take notes. So after you ask those questions, write down the answers. Every time when you're an intern, you do a procedure, write things down. And then every time you finish a surgery, as you start to do them independently, or even spend 15 minutes with your chief in the OR as an intern, write things down. Look at how the room is set up. Look at what supplies are in there and figure out what you can take from a case. Think about how the patient was positioned, how the incision was drawn, opening, key steps, closure, and what the post-op plan for the patient is. And then any other attending preferences. I think that one of the great things about this program is that we have so many attendings, some of whom trained here and some who didn't, and people who do things completely different ways from each other. So while sometimes it's frustrating to try to figure out why you're doing something one way, and then the next week you're doing what seems to you to be the exact same case in a completely different way, there's probably a reason. There may not be a right way between those two, but you'll find yourself in situations where one works better than the other based on the patient's history or the equipment that you have, or other things that come up while you're operating. So I really appreciate knowing multiple ways of doing things. And then treat your job like people's lives depend on it, because they do. Neurosurgery is not a job that you get to show up to and take lightly every day. You really do have people's lives in your hands. And someone told me when I was a young resident, just to keep in mind that the day that these people meet you is probably the worst day of their life. You generally don't meet a neurosurgeon, especially in the emergency department, on a day that's going well for you or your family. So keep that in mind and treat everyone with kindness as you think about that. Show up every day prepared to do your best, and remember that no task is too small. This is a picture of our dear chairman lying on the floor of the Harborview operating room to make sure that this small child was positioned appropriately for surgery when we were trying to do big surgeries on little people in the Harborview ORs when children's ORs weren't available to us. So take after him and remember that no task is too small for you, even though you're the big bad neurosurgeon. And then also importantly, take time for yourself outside of the hospital. even if it's with the people that you spend all of your time in the hospital with, go out and do other things with them. It's okay if you meet other people too, but if you can't, because you're weird like all of us, then spend time with your work friends outside of work. And then I just wanted to go through and thank a lot of people. All of the faculty members here have taught me so much over these years. I can't name all of you because there are just way too many, but I like this picture in the bottom right. It's a picture from when we were very junior residents, and all of the people who are here then, one of the, I think, last big group photos that we did as a program. And then kind of all of my chief residents, all of my junior residents throughout the years who I've learned a lot from. In particular, I'd like to thank my classmates. We have a lot of the same pictures because we weren't that good at taking pictures over the years. But I really appreciate going through this entire process with you guys. And I couldn't imagine a better group to have spent 7 years with. And I've learned a lot from you guys, and will miss you as, you know, 2 of you go off to the East Coast and probably never come back to the mountains. Because I know you don't love them the way that I do. Even though Rajeev promised that he would go hiking with me and Gil during the beginning of residency, he sheepishly at the end admitted that he didn't actually like it, and that's why something always came up at 6 a.m. when we were getting ready to leave. I think he'll be a lot happier in New York. I wanted to thank all of my chief residents throughout the years. I've learned a lot from all of you. Some of you have come back. I know Doctors Emerson and Ruzovic are experiencing the joys of hanging out with me again on my skull-based rotation. But in particular, this class of chief residents who I think experienced a lot of the growing pains of my class as we were there, or twos when they were chiefs. I learned a lot from these 3. Somehow convinced 2 of them to come back and be my attending as I was back at Harborview last year as a chief, and then Bales, who ran away to Alaska. I think from these 3, you know, I learned what type of neurosurgeon I wanted to be, what type of resident I wanted to be, and what type of chief resident I wanted to be. I also learned that there are many ways of doing the same case, all of which will end in a good result, because every time that I asked for advice when I was doing a case the first time, when I was in R2, I would talk to whichever 2 were at the hospital with me and ask them how they would do it. I'd go to the next one, they would tell me something completely different. And then often a week later, I learned that there was a completely 3rd way. And even though they all trained in the same class in the same place, they somehow do things completely differently. And I think that, you know, again, that's one of the values of this program, is that you learn multiple ways. And I think that I'd like to think that I've become some kind of a combination of these 3, because I think that they were all excellent. And then I wanted to especially thank my research mentors who helped me through the grant writing process and the projects that I promise I am still working on in between cases. So Dr. Chesnut, Dr. Bono, and Dr. Temkin, who've done all of my TBI research with me. And then also Jason Barber, who has patiently worked through all of this data analysis with me, and without whom I could not complete these projects. And then in particular, all of the spine faculty here. Some of you I just met and started working with this year. But, you know, I'm learning different things, you know, going to Northwest, learning different ways of doing things in a completely different hospital setting. And then all of our faculty at Harborview and UW hospitals. And then in particular, Dr. Zhang, who makes a claim that he's taught me everything that he knows, which could never be possible. I could not possibly ever know what he knows, but I really appreciate that he tries. And then Dr. Ellen Bogan, of course, for letting me come here and forming this department into what it is today, and all of our associate program directors for helping mold all of our hospitals into the learning experience that they've become. And then I also wanted to acknowledge my parents who have supported me for all of these years, no matter what I wanted to do, including the day that I called them and said, you know, I wasn't sure what I want to do, but I think I want to be a neurosurgeon. And they said, okay, what does that mean? I was like, well, it means 7 years of residency, then I called them at the end of my sub-I here and I said, I'm really sorry, but I really want to move completely across the country for those 7 years. And, luckily for me, they supported me, even though I know that they hated that thought. They wanted me to be wherever I thought I would get the best training and wherever I thought that I would be the happiest. And then also to my boyfriend, Kevin, who has, I think, had no idea what he was getting himself into as a software engineer when he met me and decided that he was going to start dating a neurosurgery resident, but who has been by my side this whole time and helps me take advantage of the vacation time that I do have, taking me on amazing trips and keeping me entertained, and most importantly, keeping me fed when I come home at 1 a.m, too tired to figure out how to use the microwave. He's always there. So thank you to all of you. I'm really happy that I got to be here for my training and work with all of you and learn from all of you. And yeah.
Rajeev? He's hydrated.
Hydrated.
One moment, we're just gonna try and fix some IT issues.
So I can do my fun fact. I'll go back to when I was a sub-I, say the same thing. I'm Rajeev and I'm a huge Denver Broncos fan. I got some booze at that point, actually. And thanks for Russell Wilson, so I can boo back.
So while we're waiting, I want to again thank all the faculty. This isn't anybody's program. This is our program. And I look at every single one of the faculty have had a huge imprint, and I can hear it in the way they present and what they say. The strength of the residency of the people sitting over there are residents, and the faculty, including our research faculty, Nancy Kemp is trying to hide behind, but Jake Newsday, which Jake, the only person that can, the only person that can do that behind these. So, I really want to, as we're setting up, thank you all. Every single one imprinted something on these residents, and thanks for your excellence. Okay.
No, but at least let's mute it. Do that.
Rajeev, why don't you explain to us what the slides?
I can reenact them. It'd be pretty ugly.
Can people on,
Did
can people on Zoom still hear?
the slides work?
Yes, we can.
Thank you.
Okay, why don't we just get this?
We can-
line?
Sorry, we couldn't get rid of meeting controls, but hopefully feedback problem has been fixed.
All right, let's just get the talk. So,
Oh, God. There is no cancelator.
Yeah, Charles.
And I thank you for your patience. One of the problems with all these new rooms that we're having, and we'll see that at BWMC, seeing that here is getting the IQ down.
What happens when you click Zoom?
Let's just get him to his talk.
Okay.
You have to put the mouse over the screen too. So the way it
Like
works.
when I share, when I should like.
No, don't share it. So minimize it and just move your mouse over there. You have to move it over like your mouse,
Oh, I see.
like this. See, you have to control the mouse and hit cancel. Oh, there we go. Yeah.
Gil has always been my IT guy.
While we're there, let's go over.
Oh,
to-
more.
excuse
We
me,
can do
yeah,
more. Okay,
Yeah, we can get
Great.
rid of the.
let's do more. More.
Yeah, hide the panel. Yep. Yeah.
Okay. Wow. Thank you. Thanks, Gil. As usual.
Now bring it back over to you. Bring it back to your side.
There it is. Found it. Okay, great. Okay.
Yes.
All right.
Lessons learned. So I said, that's it. I got 5 minutes left. So I made a last minute change to the title. I just took after Gil. It's another Dr. Kim quip. Pay attention, my friend. The junior residents will get that one very soon. And I've structured into 3 parts, just like Dr. Ko taught us. Everything's in 3 parts, and Dr. Silverhill. How I got here, why I came here, and a bunch of thank yous. So as many of you know, I'm from New York. That's a map of the New York City subway, and my entire life was along the 1 train here on the west side of the island. I grew up here on 59th Street, took the train all the way up to 242nd Street for high school, elementary school, took the train back down to 116th Street for college, and then popped over to the east side for medical school. And all along the way, the Pacific Northwest, Seattle wasn't even a thought in mind. And it was really thanks to these 2 people who really sparked my journey here. In the middle there is my closest friend, college roommate, Ryan Eaton. He's a CT surgery fellow now in Michigan. And he's also Jake Rusevic's cousin. And when I told Ryan that I was applying to neurosurgery, he connected me to Jake. And I cold called Jake on like a Saturday morning. And I forgot about the time difference. So I called him at like 6 o'clock or something. He was post-call at Harborview and obviously exhausted, but he took the time, answered all my questions, was incredibly enthusiastic. And next thing I knew, I was a sub-I here in July, and then intern at UW getting prodded along on rounds by Sam Emerson. And one of my earliest memories when I got here, interactions with an attending was with Dr. Kim. I think it was at the holiday party, and we were talking to each other about moving from New York to New City, and Dr. Kim said to me, he's like, when I moved to Phoenix, I remember getting there and thinking like, oh my God, what have I done? He's like, I bet you're thinking the same thing. And I was like, you're exactly right. But then he said to me, he's like, somewhere along the way, you'll realize that there's a reason that you came here. And so the rest of the talk is exactly about that, the reasons I came here. And first, I think this is universal amongst every resident that comes to this program, is the operative experience, the operative volume. That's why we come here. These are just some of my case logs from my chief years, and UW far exceeded any expectation I had. And I would put these numbers up against any graduate around the country, and I'm extremely proud of it. And it took a lot of work, and it was all thanks to the attendings and the opportunities I got here. But just going with a lot of operating, there were a lot of mistakes. I'm sure every attending here has some bonehead mistake I made in the OR. That is a bone flap there on the floor, picture courtesy of Dr. Ko, and that was literally 3 weeks ago. So my lessons to the residents are, number 1, it's just coming here, like showing up here doesn't make you benefit from the volume. It takes a lot of work when you get here. You have to show up to cases, you have to operate post-call. And then there's a lot of effort you have to put in around operating. You don't just exist in the operating room. You have to think about the case, how are you going to position and visualize. It's something I learned from Dr. Lee when she talked about her routine when she's scrubbing in for a case, and Dr. Shaker taught me that as well. Like, visualize the case, visualize how you're going to do the approach and how you do the critical portion of the case. All of those mental reps go into like actually benefiting from the volume here. Number 2, develop thick skin. So my first experience in the operating room with an attending alone was Dr. Ferreira doing a pituitary apoplexy. And while we were scrubbing in, Dr. Ferreira goes, what happens in the OR stays in the OR. So I was, aside from being terrified, what I think what he meant by that is that, this is a tough field. They're tough people. It's an intense job. The stakes are high. Try it. I promise you 100% of the time you're getting negative feedback or some criticism or whatever it is from a chief and attending, there's something you could have done better. So I encourage you all to always think about what you could have done better and to kind of get past all the emotional aspect of it. And then never forget your complications. This is something that Dr. Kim really drove home to me when I was vascular chief. He said, you owe it to your patients to do everything you can to learn from your mistakes, learn from your complications, and never let that happen again. Yeah. It wouldn't be complete talk without including my worst mistake in the OR. Letting Dr. Lee give me a haircut during COVID. that was devastating. Yeah, I don't think my hair has recovered. It's just like, there's no turning back. You're an amazing surgeon, terrible barber. Let that burn into your minds for a little bit. Reason number two is research. So we all came here again, not just to operate, to be in a very academic environment. And I was lucky enough to work with, Dr. Levitt, Dr. Shaker on some great projects. Got a grant for single cell RNA sequencing on aneurysms. I worked on an AI project for predicting outcomes. Got to write book chapters and present at conferences, but I really, as you can see, my publication count really not awesome. To me, a little bit of a letdown. Definitely wasn't as productive as I wanted to be, and that wasn't for a lack of opportunity or for resources or time. That was all on me. And so my take home, my lessons for the residents from there are start early and find mentors. This program is too clinically rigorous to just go from 0 to 60 or 3 or 4 year. You really got to start intern year and develop those relationships. And then projects die quickly. You can ask Dr. Shaker. I'm probably the king of dead clinical projects. My best advice is you got to ride that momentum when you get a project and see it through. The longer these things linger, the less likely they're going to get done, and that happens pretty quickly. And then last thing is on the academic point, our department's very generous in paying for us to go to conferences. We can always work the call schedule out, and I encourage you all to at least once a year submit to a conference, attend a conference. Those are amazing opportunities to network, practice public speaking. You get to, if those of you who don't know what you want to do, it helps you figure that out, and they're honestly just fun and inspiring and get you excited for the future, especially when you're bogged down in residency. Okay. So reason number three, and by far the most important reason, is, I came here for the people. As Maddie pointed out, I didn't come here to hike or bike or snowshoe or, like skinny dip. I just, I came here for the training, and I came here for the people. And the people have been, amazing, cream of the crop, from start to finish. And there are a lot of people to thank. And first, all of the people outside of attendings and residents that go into our training, they're like innumerable people, and there's nurses, APPs, OR staff, device reps who help you. I mean, they're just countless people to thank and appreciate, that help us kind of get through the day to day, and honestly that teach us a lot, especially in the beginning as you're getting familiar with the ORs. All our administrative staff, so Julia, Sylvia, Megan, Ann Hammond, there's like an army of people that feel like they, at least from our perspective, work behind the scenes to make residency a reality and work really hard to allow us to pursue our dreams. So thank you guys for all the work you put in. And then, of course, all the other services we work with, to thank them for putting up with us for all these years. On to the residents, starting with Sanan, Gil, and Maddie. We're I think an unusual group, and I think we all, I think we all brought something different to the table. I learned something from each of you, how you guys do things in the ORs and the hospital, and I'm thankful for you guys for putting up with me and my antics when the chief called and doors closed. So I'm excited for our next step together, and you guys have been amazing co-residents. The picture on the left there is from 2017. I think it feels like that was like the last time we all took a big group picture together like that. But I had amazing chief residents, and like from Bono Buckley Bales, Josh Abicassis, Lynn McGrath, Chiba, Sam Emerson, Jake Ruzovic, all the way down to Mike Meyer, and like they were incredible role models and even better friends, and they made coming in as an intern and being in the hospital fun and interesting, and really helped me get off on the right foot. So I'm really grateful to have had them. And then to all the current residents right now, especially the junior residents, I appreciate all the work you guys put in. Shout out to Kate, Zach, Eliza, and Evgenia for all the work you guys put in. When I was your chief, I mean, you all that stuff let me focus on, you made my life easy and allowed me to focus on what I needed to do, but at the time, which was operate. So I appreciate all that, and you guys are all going to do amazing things. And I promise you, every year gets better. So just keep on powering through. To all the attendings, I did try and map this out and have something to say about each of you, but that was going to take like 30 minutes. So I'll say I have learned something from every single one of you, either in the hospital, in the OR, outside the OR. Dr. Elmbogen has made this amazing group of faculty. I legitimately came here. One of the main reasons I came here was for our faculty. And I'm incredibly grateful. I've now learned how hard it is to teach neurosurgery and to watch us operate. I appreciate the patience, and thank you for giving me this foundation that I'll carry with me for the next steps and beyond. Dr. Ellenbogen, I knew I had a connection with you when we first interviewed, and we were talking about you being a Jewish man from New York, which is basically like a second father to me. We talked about that John Wooden poster you have in your office, and you have been the incredibly supportive leader and this fearless leader, and I appreciate everything you've done for us, taking a chance on us, and just really lucky to have the best chairman in the country. And then, of course, last but definitely not least, thank my family. It's my sister there on the left with her husband, my mom in the middle, it's my dad on the right. I don't thank my family enough on a day-to-day basis. I doubt this makes up for it. But I'm very, very lucky to have had them. They've pushed me, they've inspired me, and I'm very thankful every single day for them. And then the last note I'm going to end on is this quote from Nick Saban, greatest college football coach. There are three things we can't have. We can't have complacency, we can't have selfishness, and we can't lose our accountability. And I want the residents, if there's anything I've ever taught you or anything is to take home, is that being here at UW is not, it's not a right, it's not, you're not entitled to it. It's a privilege. It's a privilege that you have to earn every single day, and you owe that to your patients, to your colleagues, and most importantly, you owe that to yourself. So I want you guys to think about that every day. And if you follow those, that simple philosophy, I promise you the sky's the limit in this program. So thank you for your time. Thank you for everything. And hopefully we can go out there and make you guys proud.
There we go. Some people.
All right,
Now move the mouse back.
fantastic. I'll try and be mindful of everyone's time here, and just go through some lessons that I've learned throughout my 7 years. First and foremost, it's 7 years for a reason, and I believe this is because everyone goes through the same learning curve. If you look at someone's training and map it out over time and look at their experience versus their confidence, early on in the learning curve, you gain a lot of confidence despite gaining very little knowledge. And that tends to peak at what we call the peak of Mount Stupid. And that's when you're at your most dangerous. That's when you're liable to make mistakes. That's when you don't know what you don't know. And those mistakes can really hurt people. And as you start hurting people, you enter the valley of despair. But as you fall down this peak, you're actually gaining a lot of knowledge, but you're totally losing confidence. And the point of residency is not to stay in this valley, but it's to pursue, it's to keep going and grow through that adversity and climb the slope of enlightenment until you reach the plateau of sustainability. And that's what everyone can go through. That's what everyone does go through. And you realize going through this process that, you know what, Dr. Lazar was right. This is a contact sport. You got to go into that corner. You got to fight for the puck. You're going to get hit. It's going to hurt. And the point is to come out of that corner with the puck on your stick. And even when you come out of that corner with the puck on your stick, you're still going to get hit. You're still going to fall down. And residency is not about falling down. It's much like the old sports metaphor is it's about getting back up again and growing through that adversity. Or as Dr. Hofstadter likes to say, you just got to proceed. Next lesson, be like Dom. And yes, I'm talking about Dominic Nistall. Dominic Nistall has the uncanny ability of convincing every attending he works with that he is going into that specialty. And I don't have that ability. I wish I did, because if I did, God knows my residency experience, particularly on the functional rotation, would have been a lot better. But the reality is you're here to learn from everyone. And across the board, across every specialty, across all hospitals, you're going to take lessons from everyone you work with, whether it's the skull-based faculty, the vascular faculty, the Harborview trauma people, the children's people, at the VA, or even at UW. And like Gil said, your job is to take the good and leave the bad. The corollary to this is find good mentors. Mentorship is hard to quantify. It's hard to explain. We have a difficult time of truly capturing what that is. But the best mentors are the ones, the best mentorship is what happens organically. And for me, obviously, it was the spine people. Whether it's Dr. Krandikar or Dr. Mean, who incessantly texts me about what cases he does, whatever hour of night, I'll get a text from Dr. Mean being, oh, look how cool this case is. I'm like, Anu, it's 11 o'clock. I want to go to bed. Or Dr. Khan, Dr. Chestnut, or even Dr. Lazar and Dr. Houston are our recent former private practice guys. There's a lot of information and knowledge and practical experience to be gleaned from them. Two people I want to highlight in particular are Dr. Hofstadter, who's been a fantastic mentor to me ever since I first came to this program. He's been a huge advocate of mine. I don't see him here now, but I don't think he truly appreciated how difficult I would make it on him to be an advocate of mine. But I appreciate everything he's done for me inside the operating room and as my research mentor, setting me up for a career that I truly could not have anticipated. He always made time for me. This is a picture of us having a research meeting while I was on the ice. So I appreciate everything he's done for me. And the second person is this man right here. If you don't recognize who this is, I'll zoom in on the face. This is Dr. Zhang. Dr. Zhang, as residents, I think we're all looking for someone to emulate and someone to be when we grow up. A lot of people say, I want to be Dr. Silbergo when I grow up, or I want to be Dr. Shaker when I grow up. And I want to be Dr. Zhang. Anyone who's scrubbed in with me knows that I wear 7.5 ortho Browns. Why do I wear 7.5 ortho Browns? Because Fungi wears 7.5 ortho Browns. So I don't think that he'll ever appreciate how much of an impact he's had on my career and on my learning, but I truly cherish the experience I've had with him. Next lesson is build your network. You never know who in your life you're going to encounter on this journey that's going to be a lifelong friend of yours. When I was a third and fourth year medical student, I worked with this guy who was a PGY4 at the time. We would wake up at 5 o'clock in the morning on a Saturday. We would go to the cadaver lab at USF, and we would do dissections. We would do all these 3D pictures for resident education. And ultimately, both of us went into spine. Dr. Alicani is now the spine director at the University of South Florida. And he was just recently joined by this guy, who I think we all know from last year, Dr. Patrick Kim, fantastic fellow, fantastic person, came to my wedding. So you never know what interactions are going to last a lifetime. I still talk to both these guys. Just always cherish the relationships you're making. And the relationships you form can become lifelong friends. Next lesson is get a dog. Dogs are the best. That dog does not care what you did that day. That dog does not care what you screwed up, what consults you had, how many pedicle screws you put in. That dog is just happy to see you when you get home. When you're tired, when you're post-call, when you're exhausted, that dog is your napping buddy. So get a dog. Next, never forget your roots. Long before you started this job, the foundation of your character and the foundation of what would make you successful came from your parents, came from your family. Always remember the sacrifices they made to get you here. And I certainly, like Rajeev, I certainly don't thank them enough for everything they've done for me. But you're here because of them, and just remember that, keep them, they keep you humble and they keep you grounded. And speaking about keeping you grounded, choose your spouse wisely. You know, neurosurgery is a tough job. Being a neurosurgical spouse is an equally tough job, because this is normal for us. You know, working this hard, getting woken up in the middle of the night, going into the hospital in the middle of the night, this is normal for us. This is not normal for the world. So it is difficult to find a partner who understands that. But when you do, when you find someone who understands and supports that, and specifically can survive the children's rotation, you got to lock that down. Life is not lived within the four walls of the OR. This is a very beautiful part of the country we live in. And if by the end of 7 years, all you have to show for it is a list of cases and post-op scans, you miss the point of living life. Go out there and see it. This is like I said, it's a beautiful world. It's a beautiful part of the country. Also, get a hobby. There are going to be days when your battery is on empty, and you got to find that thing that recharges you, that gets you going. And when you're totally, utterly without the will to move forward, there's something in this world that's gonna recharge you, and you got to find that. If I can do this, you can do this. And there's no better support of this than this text by Dr. Kim. I'll read this for you. In room, intubated, working on lines and monitoring. I believe I'm soloed with you today. Dr. Kim replies, WTF. This was 3 weeks ago. Many of you probably don't know this about me, but I'm probably the only resident in the history of this program that has received this email. And that is not a fun day. But you know, through perseverance, through working hard, I was able to ultimately match and find my way here. I'll tell this anecdote very briefly. My first ever case at this hospital, at this program, I co-scrubbed a cranioplasty with Rajeev. He's probably long forgotten about this, but I will never forget this day. Here I am with my supposed co-resident. I didn't know how to position the patient. I didn't know how to prep the patient. I didn't know where the incision was. I didn't know the steps of the operation. I didn't know a damn thing about a cranioplasty. And if I can get from that point to here, any one of you can get through this program. So if I can do this, you can do this. And finally, it doesn't end, right? This is a graduation, but this is just another step in a lifelong process of learning. And because of all the experience I've had here, I'm definitely well suited for the next steps of fellowship and becoming a successful spine surgeon. So thank you all, and especially thank you, Dr. Ellenbogen. You know, you didn't have to give me a shot. You didn't have to give me a chance. I'm certainly grateful that you did, and I hope it made it. I hope it made you proud. So thank you all very much.